welcome to Access Rhode Island. My name is Kate Brewster, and I'm the Executive Director of the Economic Progress Institute and host of this week's program. Healthcare and health insurance have been hotly debated topics in our state and country for some time. The Affordable Care Act that passed in 2010 expands access to health insurance for many Rhode Islanders through Medicaid and commercial health insurance. The biggest change is just around the corner with the opening of the Health Benefits Exchange and the availability of new tax credits that will help low and modest income people pay for health insurance. Whether you get health insurance through work or you plan to get it through the exchange, sometimes we have problems with our health insurance. My guest today will help us understand where to go for help when we have issues or questions or concerns about our health insurance coverage, and we'll also discuss the Health Insurance Exchange that will help more people get access to health insurance here in Rhode Island and across the country in the coming year. First, I want to introduce my guest, Manny Echevarria from RIREACH. Welcome, Manny. Thank you for being here. And Sadie DeCourcy, who is my colleague at the Economic Progress Institute. Thank you both so much for taking time today to come and talk about health insurance here in Rhode Island. Let's just start by talking about the role that each of your organizations and projects have in the ever-changing world of health insurance. And Manny, why don't you start? And thanks again for being here.
Thank you for having us, Kate. RIREACH is our consumer assistance program for the state of Rhode Island. It stands for the Rhode Island Insurance Resource Education Assistance Consumer Helpline. We do a lot of support for consumers around them accessing their health care, knowing their rights, knowing their different options. The three main areas that we focus are on are affordability, accessibility, and healthcare adequacy. We've set up our phone line. We do direct support with consumers. We help them on the phone, meet with them in their community. We speak their language. We're a bilingual call center with staff that speak English and Spanish. And we have services available for folks that call in with other languages through our community partners. Our main focus of work is to ensure that consumers know what their rights and responsibilities are, not only of consumers of commercial coverage services, but also folks who have public coverage and also folks who are uninsured and don't know what the resources are available in their community.
Excellent. And your organization is actually at or a project of RIPEN,
which is a Rhode Island Parent Information Network.
And you're pretty new.
We are new. Our program actually was funded in August of 2012. Our call center has been set up and fully operational ahead of schedule. We actually started taking consumer calls late January of 2013. So we are talking to consumers. We know what the needs are throughout this vast community of folks that previously had little access to consumer support or previously did not know what the main changes would be with the Affordable Care Act that could affect them daily.
Excellent. So we'll talk in a minute about what the common problems or issues that you get on the line are. But first, Sadie, I'll let you just describe a little bit about the project that you're working on with us.
Great. Thank you for having me. And I will try to be as good as Linda Katz would be if she were on here. I'm channeling her. And so to give you a little background, I'm representing the Rhode Island Health Coverage Project, and we are a joint initiative of the Economic Progress Institute and Rhode Island Kids Count, and we are funded under the Robert Wood Johnson Foundation. And our grant has been around for about 2 years. The project's young, but still kicking. And our focus is on consumer advocacy with the exchange and with healthcare reform in general. So what we do is we take consumer issues that we think the exchange needs to hear and maybe is not, and we take it up to the state or to the exchange. And then we also take things that we think that the consumer needs to hear from the state or the exchange and take it to the consumer. And we actually have a lot of help with that with our leadership team, which we established 2 years ago as well. And we represent a wide range of communities here in Rhode Island, including the Southeast Asian community, the African American community, and the Latino community. So we are very excited for the changes that are coming, and we've been hard at work trying to make sure that all of the information that consumers need to know they will know.
And you both, our organizations just held a joint training where there was a waiting list, 200 people turned out, and more wanted to come to learn about how the Affordable Care Act, the implementation this fall and in the winter, will affect clients. So we'll talk about that a little bit more.
Great.
So, great. Well, Manny, before we talk about what's going to happen under the ACA, as we call it, and healthcare reform beginning this fall and rolling into full speed in January, let's talk about the people that have insurance now. And what are some of the common concerns or questions or issues that you get through the consumer line, and how do you help people deal with those problems?
Yeah, let me just start off by saying that trend can change almost daily. Consumers call in with a wide array of questions. A lot of consumers mainly call about affordability issues. They say, I have this insurance policy, I pay this premium a month, and I can't afford it. I'm making decisions as to whether I should just drop my coverage because I only access my doctor once a year, or should I try to save a little bit more for my child's college fund? Should I pay another payment onto my mortgage, or should I help pay down some of my debt? Folks are really aching for a lot of information based on affordability. One example that I can give you is we had one consumer that called in who was a high income earner by Medicaid standards, but because they owned a small business, the business was draining a lot of their expenses, and their take-home income actually made them Medicaid eligible. And they did not know that resource would be available to them. So there's mainly calls about affordability. The next big area are things dealing with appeals, or something has been denied that they view as an essential benefit that should have been covered. And we help them understand what their rights and responsibilities are during the appeal process. And then thirdly, the other big branch of all our calls are consumer complaints, which are consumers that feel that their providers or perhaps their issuers have not given them the opportunity to obtain a certain service, and they would like to cast a formal complaint. And we work very closely with the Office of the Health Insurance Commissioner to make sure that consumers understand their rights around the complaints, understand the complaint process, and what warrants a complaint and what warrants simply consumer assistance inquiry, such as this is not technically a complaint, but this is something that you could talk to your insurance company about, or this is an appeal, or you just need this type of information to help you move along.
And there are so many different types of health insurance plans out there. I know we get presented with a big menu every year at renewal, different deductibles and cost sharing and co-pays. Do you help people try to understand all of that if they're not able to understand it on their own? Yes,
we actually, that same family was paying into what we now call a catastrophic plan, which is a lower premium with a higher deductible, and they found that they were exhausting much of their deductible every year, and they didn't understand that there would be another plan that could perhaps make them pay less out of pocket and maybe a little bit more each month.
Right. So it sounds like you're providing a great resource, and I assume with the folks who you determine might be Medicaid eligible, they get referred to Right Care or Right Share, and you're able to help them counsel through that process.
We also make sure that as a community-based organization, we're using our natural resources. The community-based folks, the family resource counselors, there are so many great folks that do a lot of work around consumer support. And although we don't facilitate Medicaid enrollment, we can help connect them to somebody who does do that, so that the family can get the proper case management that they may need, or the proper follow-up from that community-based group.
Well, it sounds like you're doing great work. Are you getting a lot of calls?
We are getting a lot of calls. Our call volume has actually increased about 50% in the last month.
Wow.
Which is great.
And I'm going to assume that you get calls from folks who don't have insurance at all, who are eager to learn about the Affordable Care Act, so that's a great transition to you, Sadie. We know that there are plenty of people out there in Rhode Island who don't have health insurance. In fact, an estimated, I think 120,000 are uninsured today, don't have access either because they can't afford it or they aren't able to get it through work. So People are going to find themselves with new options when the health exchange opens this fall, but some other changes have happened. Can you walk us through what some of those changes are with the Affordable Care Act that are going to begin to take place in October?
Sure. So under the Affordable Care Act, states were given an option to expand Medicaid to single childless adults up to 138% of the federal poverty level, which is about $15,800. And so our state, Rhode Island, wonderfully decided to include this group of people in the governor's budget for this year. So starting in 2014, childless single adults will be able to apply for Medicaid if they are under 138% of the federal poverty level.
And they've never had access before unless
No.
they were extremely disabled or had some severe issue, right?
Right, exactly. And the other part is on the exchange side, they are having something called the SHOP, which is focused for small businesses. And a great thing that the exchange is doing is having something called employee choice. And what will happen is that if small businesses, especially, think that they can't afford to pay a certain level of a health insurance plan, they can give a certain amount of money to the employees, and the employees will be able to go into the SHOP side of the exchange and choose their plan, which is a great option for both the employee and the employer.
Terrific.
And so our last option and our last big change is something called the advanced premium tax credits, which is additional help for people up to 400% of the federal poverty level, which is about $78,000 for a family of three. And so what this entails is a little extra help in paying for your health insurance if it's almost unaffordable.
Right, and it really is an extremely expensive part of a family's budget. So can you give us a sense of how those tax credits are going to work? You call it the advanced premium tax credits, and what that might look like for a family reaching 400% of the federal poverty level, or anybody?
Yes. So first of all, you have to buy through the exchange to get this tax credit. So that's the first step. So a family will go in, or an individual who is under 400% of the federal poverty level will go in and pick a plan. And the different choices will be based on a sliding scale for the amount you pay based on your percentage of income. So I have an example and a little breakdown for you. So just for an example, between 133% and 150% of the federal poverty level, if you go through the exchange, you will pay 3 to 4% of your income. And the goal of the advanced premium tax credit is that no one will pay more than 9.5% of their income in that bracket. So 300 to 400% of the federal poverty level will be the 9.5%, but underneath that there will be some kind of a scale for the different income levels. And then to give a specific example, if we have John, who is a line cook, and he makes an hourly income of about $10.75, and he has a gross income of about $22,000 a year, which is about twice the poverty level, and he doesn't have sponsored health insurance through his employer. So what he will do is he will go through the exchange, and he will probably pay about $3,000 a year, or he would be paying $3,000 a year in unsubsidized health insurance costs. So with the advanced premium tax credit, he would have $1,407 of that covered by the federal government. And that comes out to 6.3% of his income. I'm sorry, take that back. It's the opposite way. So John will pay that much in a year, and the government will pay $1,593. So that means that John will pay $117 a month for the year, and the government will pay $133. And so also what John can do is he can decide to either take the tax credit at the beginning of the year and pay the monthly premiums, or he can choose to wait until the end to collect and pay the premiums himself throughout the year. Most people, we figure, will end up taking the pay out in the beginning and have it help them throughout the year.
Hence the advanced premium tax credits.
Exactly.
Right.
They've been trying to come up with different names to make it a bit easier for people to, take in, but they just haven't found a right term. Subsidy has been thrown out, or a discount. Yeah. So they seem to do well for certain groups, but not for others. We seem to think that advanced premium tax credit says exactly what it is, and we need to give people more credit that they'll understand it.
Right. Well, and once the marketing and all that starts rolling out, hopefully it will be more understandable and people have a lot more information. I know we're working on that with Kids Count. Well, can you just tell us a little bit about, Sadie, how people are going to apply for this? Just walk us through the mechanics of that.
Sure. So I think the best way to think of it as 3 doors that you can go through. So we have the exchange door, where people will be able to go onto the exchange website and then apply through that. There will be the Executive Office of Health and Human Services that people will be able to apply through. And then there will be the Department of Human Services that people will be able to go through to get to this one big door that will be the big application place for everyone to go to apply for health insurance. Rhode Island is unique in that they have developed something called the Unified Health Infrastructure Project, and affectionately called UHIP. And that is basically what it is. It's combining Medicaid and commercial insurance, public subsidies and things like that, all into this one application place. So I think people often think that the exchange is going to be the website, the actual exchange website will be the only place that people will be able to apply for Medicaid or health insurance, any kind of thing like that. But actually they will be able to go through the Executive Office of Health and Human Services and the Department of Human Services if they are more comfortable with those sites. But in the end, it will take them all to this main application place. And no matter if you are commercial, available for commercial insurance or for public insurance, RIREACH, Medicaid, you will get access through this one site in the end.
Terrific. So
Yes.
some severe coordination. I think it's happening behind the scenes right now.
Yes, exactly. Everyone is working furiously.
Well, Manny, this will help for all the folks the calls that you get, people with concerns about affordability.
Right.
What role does RIREACH see itself having when the exchange finally comes online? How will you work with folks at the exchange and other folks in the community?
We've actually already built some of those partnerships. I have communicated with Megan Hall, who's the exchange lead for outreach, and we actually do a lot of public information around the exchange. We've built the exchange into our presentations. When we talk to our community partners, when we talk to other community-based groups, we've built it so that consumers understand that the exchange is coming as part of the consumer assistance piece. It ends up working out great because we can help the consumer with the resources that are available now and say to them, come October, this is what's coming down the pike. We've actually kept a list of all of the consumers that we feel would meet the eligibility criteria.
Wow.
And come September, we're going to start doing outreach to them just to remind them, this is what's coming, this is how you can access it. If there's a website already live, we can direct them to that website. If the call center is up and running, we can direct them to that call center. So we're actually very energetic about this. We're very excited because folks need to know that the exchange is coming, it's being created, and that there is relief coming, especially for folks who have addressed this severe concern over affordability.
That's terrific. I think especially for the single adults who for years, we all hear from them, want to know how do we get, right care, and they don't understand that it's only available for families with children. So this is going to be just huge for those folks.
May I ask have you found that you've gotten a lot of the single adults who have been calling with questions?
Primarily, families have been contacting us, but yes, we have had many adults, just like John, that are making between 200 and 300% federal poverty level, that their employers may even offer health care, but the health care is unaffordable because of their income. One person we spoke to, I believe his insurance was about 27% of his yearly income. So it's definitely a need that will be addressed, and just one of those people that we're keeping his name, we're keeping his phone number. Come September, we're going to remind him this is what's coming, this is the paperwork that needs to be ready.
This is terrific. Wow. One by one, Manny's
know.
going to get them in.
Seriously.
For sure.
We're very committed to this, definitely.
That's great.
Yeah.
That's really important. So, Sadie, what are the state's plans for outreach and marketing and enrollment?
Yeah, so there are a couple different things that are happening right now. One is that one we don't know much about, which is the exchange's communication plan. They are working very diligently to have a set plan to roll out in the next couple of months. I'm hoping it's skywriters in the, while we're at the beach, and the floats that go over, so that I could say, oh, we gave that suggestion, which would be cool, and I think a good way to get to Rhode Islanders who spend most of their summers at the beach.
Right.
But as far as we know, they're still in the planning process, especially since there isn't a name yet. There's not a brand really created around the exchange. I do know that Rhode Island Health Source and Health Source Rhode Island are probably the two big front runners. There was one with Ocean State something in it. I don't know if you remember what it was called, but the funny thing was most people, when it was tested, said it reminded them of Ocean State Job Lot. So they thought people would get confused with the two names. Although it's an affordable place to go and buy things, so we were like, this could be a good thing. But it's probably going to be something along Rhode Island Health Source. So once they have that, then we'll start to see more of the exchange out and about and visiting as many people as they can. I do know that Megan Hall has been out to a couple of core communities that she thinks need more outreach, and has given very small group meetings, info sessions around it. I know you know the fishermen.
My husband, she called my husband, who's a commercial fisherman, and asked him if she could come down and talk to his friends at the dock.
Yes, that's just one example of the people she's trying to reach. The other two things that are pretty big that all of us health policy wonks are excited about are the request for proposals for the contact center and the navigator program, which we are now calling the Outreach and Enrollment Support Program. There's no fun name for it, maybe a OISP or something. But that came out recently. So the contact center came first, and there were probably a dozen different companies, that may be overstating it a bit, but a good amount, bid on the proposal. And they are in the process of finalizing the contract. We don't know who it is, but it's good that it's out there, and someone has most likely been chosen, and hopefully they'll be able to start building this contact center July or August. Great. Which, just as a little background, will be a place when people go online to apply for health insurance through the exchange. If they have any issues in the application process, they'll be able to call the contact center, and they'll be able to walk them through. And we're hoping that it will be a no wrong door approach. So anyone from commercial insurance to Medicaid, any kind of questions, they'll be able to help them in some way. From start to finish, which is what we're hoping. And then the other part is this Outreach Enrollment Support Program, which is what most people know as the Navigator Program, which is also going to combine the in-person assisters, which are very similar to Navigators in that they will be on the ground out there helping people enroll. I know in the request for proposal, one of the requirements was that everyone can have a computer or a laptop. So it was a good sign that they're actually going to be, maybe at a coffee shop somewhere, and people can come in and they can help them enroll, right there if necessary. So this request for proposal is actually it's actually for the Navigator manager, and they will oversee the entire program. And what they'll do is they'll decide the grassroots organizations that they will subcontract to that will actually go out and do that enrollment. And as of when the RFP bid closed on June 4th, the Rhode Island Health Center Association were the only people who had bid. So they will be most likely the
chosen ones.
Yes, the chosen ones to do all this great work.
They actually had also applied for a federal grant that would assist them with this project process as well. Is that correct?
Yes, exactly. It's actually for all of the health centers in the state. They have the possibility of getting almost $1 million to hire more people to help with enrollment and outreach.
Terrific.
Yeah, which is great. We're going to need it.
Lots is happening, and it sounds like there's some jobs that's going to be created from
Yes.
this as well, which
Yes.
we all know Rhode Island can use. Manny, just going back for a minute, we know that not everybody is going to be eligible, even through the exchange. But, people may still not be able to afford it. So, what do you tell folks now who call, who maybe aren't going to be able to get affordable coverage through the exchange? Where can they go for health care?
Yeah, we actually try to look at what the natural resources are within that family or within that person's scope. Sometimes we get calls from folks that say, I just lost my job, I'm losing my coverage, are there options for me now? We talk to them about COBRA a little bit. We talk to them
being able to purchase their insurance through work, right? While they're unemployed.
Right. So it's actually something that permits folks who have recently been laid off or lose their jobs to remain on their former employer's health care benefits. Not all employers are actually responsible to actually do this, but some folks may be eligible and some folks do take advantage of that. Other folks we have referred to the free clinic or Clínica Esperanza. We refer folks to the community, to charity care through the hospitals, so that folks are at least being followed up with and their medical needs are being met. I find it's far more expensive for folks to end up in the emergency room than to utilize some sort of community-based program that can help them through either a sliding fee scale or free care.
That's great. And the community health centers, which you may have mentioned, certainly are another place for that. So we've got a couple minutes left. Manny, how can folks reach you? How do they get in touch with you? Do you have a website? Do you have a phone number?
We have it all.
You have it all?
Our phone number is, it's a very easy one to remember. It's actually our program name. It's 1-855-RIREACH, so that's RIREACH. And that translates to 1-855-747-3224. We also have our website, www.rireach.org, and we have our email where folks could send any type of inquiry or just a question, which is rireach@ripin.org, our parent agency, RIPIN.
Excellent. Well, it sounds like you're doing a tremendous amount of work at a perfect time. Sadie, tell us in the last 30 seconds how people can find out more about the exchange, how they can get in touch with you and the project.
Yes, so if they go to the economicprogressri.org website, we have a direct link to our project where they can get a lot of information about changes in healthcare and what's going on in Rhode Island. If they want general ACA information, they can go to healthcare.gov, which is the federal website and has wonderful information for everyone.
Excellent. Great. Well, so much is happening. It's really an exciting time for people to be able to get care. We know that for a very long time, so many people in our state have been without health insurance, and we're really looking forward to working with government and with the community, organizations like ours, and getting the word out and making sure that everybody who is able to gets enrolled. So I want to thank you both so much for being here.
Thank you.
And
Thank you for having
expect
us.
your calls, your phones to ring even more after this show. But thank you both again, and we will see you next time.